Good morning. We are going to talk about a topic in pharmacology in nursing. A topic in pharmacology in nursing on route of drug administration. What is route of drug administration? Route of drug administration can be defined as a channel through which drug is administered. The channel through which drug is administered. Or example of the routes include oral route, parenteral route, and topical route. The parenteral route include intramuscular route, intravenous route, subcutaneous route, intraarticular, intrathecal, and so on. Then topical routes include lotions, vaginal route, drops such as eye drops, ear drop, rectal route, and so on. When administering the drug, the following principles must be followed, which is commonly put as the 5R of drug. The 5R, that is the right patient, the right dose, the right time, the right prescription, and the right route. It is important for you to know about these key principles of drug administration. When administering drug, you must ask this question: am I giving the right patient the drug? Am I administering the drug through the right route? Am I administering the drug at the right time? Am I giving the right dose? Am I giving the right prescription? It is key in drug administration. The right patient, the right drug should not be given to the wrong patient, or it should not be given through the wrong route, and it must be given at the right time. Don't give it 2 hours late or 2 hours before time, as commonly practiced by some. When you are administering drug, give it at the right time or within the duration for the administration. For example, if you are supposed to administer drug at 12 o'clock, give the drug at least, if you cannot give it at that 12 o'clock, give it 30 minutes to or 30 minutes late. Within that range, it should not be far later than that. We are going to talk about oral route of drug administration. The oral route of drug administration. The oral route of drug administration are drugs that are given through the mouth. Example of drugs that are given through the mouth include tablets, capsules, syrups, lozenges, emulsions, and so on. Some are even given in form of drops. They are oral drugs, or they are given through oral route, or they are oral drugs. The advantages, we'll look at the advantages and disadvantages of oral route of drug administration. What are the advantages of oral route of drug administration? One, the drug through this route is very convenient. That is, the patient can take the drug anywhere. Home administration of this drug is very possible. Patient can be discharged and take this drug at home. The patient can take this drug even in the car when traveling, because it can be administered by the patient himself or herself. The second advantage is that the route is very cheap. What you need for the administration of this drug is just water, a cup of water, and the tablet. Or if it is syrup, you just need the syrup in a spoon and you take. Or the cup, the measuring cup that you use in the administration. The route is cheap. The route is easy. It doesn't need privacy, unlike that of the IM route. For IM route, it requires privacy. For oral route, there is no need for privacy for oral route of drug administration. Another advantage of oral route is that in case of toxicity, the patient may vomit the drug, or antidote may be given to reduce the toxicity of the drug. Unlike IV route, once the drug is administered, or IM route, once it is administered, it is difficult to be withdrawn. The disadvantages of oral route. Disadvantages of oral route. Oral route is slow. It has a slow action compared to the IV route. IV route is fast. The action is rapid. Once it is administered, the action of the drug is rapid. The second disadvantage of the oral route is that the drug is not convenient for unconscious patients. It is not convenient for patients that have diarrhea and vomiting. Another disadvantage, because once the drug is swallowed, it will not stay long in the stomach. It will be vomited. Another disadvantage is that the drug may not be tolerated for those that vomit easily. A moment the drug enters the mouth, some will vomit it immediately. Another disadvantage is that the drug may be forgotten. Since this drug is given by the patient, can be taken by the patient himself. When the patient when the patient take the drug home, there is that tendency that he may forget to take the drug. Unlike IV route, since it is given by the professional or by the nurse, the drug will not be easily forgotten. The nursing implications for oral route of drug administration. The nursing implication. 1. Ensure that the syrup is shaked properly before administration. Check the measurement of the drug very well before administration. The second one is check the dosage of the drug and the prescription of the drug when administering oral drug. Tablet should be given with adequate water so that it will propel the tablet into, or the capsule into, the stomach for action. The nursing responsibility for oral route of drug administration. 1. Give tablet or capsule with sufficient water to propel the drug into the stomach of the patient. 2. Patients who have difficulty in swallowing must or should take the drug in liquid form. That is, pound the drug and dilute with water to enable the patient swallow it. 3. Ensure that patient have swallowed the drug before leaving the patient's bedside. 4. Discuss the possible side effect of the drug with the patient. 5. Educate patient about the time for taking the oral drug during discharge. Explain to him how and when to take the drugs during discharge, and remind the patient to come for follow-up. Book the patient for follow-up during discharge. Ensure taking of vital signs to ascertain whether patient will continue or discontinue drug. Parenteral route of drug administration. Parenteral route of drug administration. There are numerous parenteral routes of drug administration. These routes of drug are faster and safer than the oral route of drug administration. They are injectables. These are injectables that are given. They include intravenous route, intramuscular route, subcutaneous route, intradermal, intraarticular, intrathecal, intraperitoneal, intrapleural, intracardiac. Intravenous route. The drug is injected directly into the vein, usually the arm or hand. The drug is injected directly into the vein, usually through the arm or hand. This route shows the first pass effect as it goes directly into circulation. Advantages. This route has advantages and disadvantages. The advantages of intravenous route of drug administration. 1. It has rapid onset of action. That it is fast. It is faster than the oral route. 2. The whole injected drug is almost instantly bioavailable, since it passes the influence of gastrointestinal tract and first pass effect. A higher dose is administered than if it is given orally. A higher dose is administered. Like for instance, IV fluid, like 1,000 ml, can be administered as a dose through the oral route within a given period of time. It's quite a big dose. Or drug transfusion, a blood transfusion, can be given through this route, which is a good advantage. The route is good for patients that cannot take drug orally. It's good for a patient that cannot take drug orally, or patient that vomits after taking oral drug. And patient that is also good for patients that have diarrhea and vomiting. The drug can be used by patients suffering from. It's very good for patients who easily forget taking of drug, because it is a professional that usually administers the drug. Disadvantages of IV route of drug administration. Disadvantages of IV route of drug administration. The administration of drug requires skills or is done by trained personnel, unlike oral route of drug administration. The route is more expensive than the oral route. Oral route, you just need a cup of water for the patient to take at a time. While for IV route, you need a given set, you need a cotton wool swab, you need needle and syringe, you need cannula and plaster, which is more expensive if you are to compare with oral route. If you accidentally administer overdose, if accident of overdose occur, the effect is dangerous because you cannot withdraw the drug that you have administered. Oral drug can be taken anywhere, unlike IV drug. For oral route, you can take it anywhere, but for IV, it must be given by a professional. Complications such as phlebitis, swelling, abscess may occur as a result of intravenous administration or setting of line. Another disadvantage is there may be difficulty in setting line. Difficulty in setting line. The next route that we'll look at under parenteral route is intramuscular route. The drug, intramuscular route, the drug is administered into the muscle. Large muscles are mostly used for the administration of the drug. Example, deltoid muscle of the arm and gluteal muscle are the buttocks. The rate of drug absorption depends on the amount of blood supplying the area. This route has advantages and disadvantages. The advantages: the injection is technically easier than the intravenous route. This injection through the IM intramuscular route is technically easier than intravenous route, which requires setting of line before administration. While in IM, the administration is done with just needle and syringe. This route does not come in contact with the effect of gastrointestinal and first pass effect, which reduces the strength of the drug. It is cheaper than intravenous route. IM route is cheaper than intravenous route. That is, for IV, you need cotton wool swab, giving set, cannula, needle and syringe. While IM it only require needle and syringe and the medication. The fat-soluble drug can be given only by this route. Fat-soluble drug only can be given by this route, which is not usually used for IV in most cases. Irritants, colloid, and suspension can also be given by this route. It is good for unconscious patients. This route is good for unconscious patients, unlike oral route. It is good for patients who cannot tolerate oral drug. Disadvantages of IM route. Disadvantages of IM route. The route is painful and most patients don't like it. Smaller meals of drug is given through this route, unlike IV, where up to 500 mils and above can be administered. The drug, once given, cannot be withdrawn. Unlike oral, when oral is given, the patient may vomit. It may lead to complication of IM injection, e.g. abscess formation. The next topic we'll look at is subcutaneous route. Subcutaneous route. Subcutaneous route is widely used. Common site for injection for subcutaneous route include the thigh, upper arm, and lower abdomen. The skin is pinched and the needle is inserted so that the drug is administered under the skin layer. Example of drug given through this route include insulin, some local anesthetic agents, The route has advantages and disadvantages. Advantages of subcutaneous route. 1. Absorption of drug is sustained and uniform than IM route. 2. Subcutaneous injection can be administered by the patient, unlike IM and IV. Patient can administer the drug by himself or herself. Drug implant is administered through this route, which effect lasts for a long period of time. It can be given for 3 years or the effect lasts for 5 years. It is good for patients who cannot tolerate oral drug. Disadvantages of subcutaneous route. It is not suitable for large volume of irritant preparation, unlike IV route. It is not suitable for irritant preparation, unlike through IV route, can produce eye abscess. Irritant preparation through IV route can produce abscess, unlike through IV route. When this irritant is given through subcutaneous, it can produce abscess. It is more expensive than oral route. The fourth disadvantage is that needle may puncture a slammed blood vessels and cause bruising of the skin. It may puncture a slammed blood vessels and cause bruising of the skin. The nursing implication for parenteral route. Nursing implication for parenteral route. 1. For IM, ensure that the drug is given through large muscles like deltoid muscles and gluteal muscles. The one that is given through the gluteal muscles, make sure that it is given at the upper outer quadrant of the buttocks to avoid injury to the sciatic nerve. Ensure that cotton wool swab is used before inserting the drug to avoid or prevent infection. Ensure that the drug, IV drug, is given through the vein. Always check the patency of the given set and make sure that the cannula is in situ to avoid tissue or avoid administration of drug into the tissue. The patient should be informed or consent must be taken before administration of IM drug. So that the patient will not be anxious or confused when administering the drug. The privacy is needed when administering IM drug. So provide the patient with privacy. Thank you for listening. Don't forget to subscribe like, and make comment on my channel. Thank you.